From COVID-19 to inflation, more stress and anxiety is being added to our lives every day. And as a result, people are increasingly suffering from sleepless nights or even just bad sleep quality. Often bad sleep has to do with teeth grinding, and this trend has become so bad that dentists and surgeons are really raising alarms now. Dr. Mark Stein is a leading dental surgeon in New York City, here to help us rest easy. Welcome to the show, Doctor. A pleasure to have you on. Now, we've talked about mental health issues on and on in headlines, especially people dealing heavily with anxiety and stress. And stress is a key factor that often reflects in restless nights. What are you seeing on your end in results to people coming in with these sort of issues?
Hi, thanks so much for having me. So over the course of the pandemic, we've seen a tremendous uptick in the number of patients that are presenting with fractured or broken teeth due to tooth grinding at night. Tooth grinding is a very common habit that many patients have, but over the course of the pandemic, we see that people are doing it more and more frequently and then subsequently breaking teeth that may have had restorations, fillings, crowns in the past. Now they're being broken to where they require a removal or an extraction and then subsequent replacement with, for say, a dental implant.
So why are more people coming in with the issue of teeth grinding? Do you think that because of the economy that we live in, perhaps, more stress and anxiety from the pandemic as well? Is this what brings on teeth grinding and we don't even realize?
What we've heard from patients that have come in with these issues is they're certainly more concerned about the economy, finances, at least on our side of the world, increasing gas prices, instability in everyday lives. And so that comes out while they're sleeping subconsciously through clenching and grinding.
Now, teeth grinding, we know, affects so many people, but so far it seemed the only solution was sleeping with a night guard, which many avoid simply because it just looks so uncomfortable. But you're doing something different. You use Botox. How does this all work? What's your solution?
So we've developed some unique methods in how to mitigate or try to reduce the amount of damage that patients cause to their teeth by tooth grinding. Since tooth grinding is a habit, we can't really eliminate the habit, but we can mitigate it by reducing the amount of force that patients exert when they're grinding their teeth. Botox is a chemical that's known to most of the world for cosmetic reasons, for injecting into lines and wrinkles to reduce lines and wrinkles on their forehead or around the eyes. We've developed a method where we can inject small controlled amounts of Botox into our masseter muscles. These are the muscles that are located on either side of our jaw. These are the muscles that we use to chew and clench. And so by injecting small amounts of Botox into those muscles in a particular area, it reduces the amount of force with which patients are clenching. So therefore reducing the chance that they would potentially break a tooth. In combination with those night guards that you properly mentioned, it really reduces the amount of damage that patients can cause to their existing teeth.
So essentially you're seeing people in your practice whose teeth are still intact despite the grinding, but you do see dramatic scenarios as well, like broken teeth. So what do you suggest in those cases there, just before we wrap up?
So for patients that have normal teeth that have not been broken because of tooth grinding, we suggest a combination of a night guard as well as an evaluation if they qualify to have Botox injected into their masseter muscles. Those patients that have already broken teeth, unfortunately, the treatment would be to remove the tooth, prepare the area, and then eventually replace the missing tooth with a dental implant, which is what we specialize in as well.
Well, thank you for bringing this issue to light. Definitely something that a lot of people do suffer from, and a better solution than the mouth guard there. Dr. Mark Stein, thank you, live from New York City.
Thank you so much for having me.